Hello guys, welcome back. So this is Dr. Ranjith. I have Dr. Sandeep with me, who is a surgeon, and he has a problem in his hands, like you can see. And today we have a great announcement. I'm sure most of you guys must have gone through the PDF again and again and see what is wrong and what is right and what is the clarity we got about that. We're just going to have a quick discussion about the slide which I have focused. I think this is the most important slide. The pattern is more or less clear. The exam schedule is going to be in 3 days with gaps, so 6 days of exam. So our understanding is what is going to happen in next exam. One thing is clear: 2019 batch, as per the current today's morning discussion with the NMC chairman, will be sitting for next. That one thing they are very, very clear about, and they will make sure that next is going to happen for the 2019 batch, who's currently in final year, right? So when is a concern, definitely we'll be addressing that concern soon, and we'll say what all information, what you got, and how we can take it forward. And this, they didn't comment anything particularly on the NEET PG exam as of now. So for interns and post interns, what we expect is this year there will be a NEET PG exam. And in addition to that, yes, you will also have a next exam for your final year MBBS students. So most likely there'll be 2 exams. So when a NEET PG exam is going to be there, we are not yet sure. But what is being told in next is, like you can see in the slide, we are going to have the next exam, the next one, as well as the next 2 twice a year. Next one is supposed to be in November and May. 23 or 24, you're not yet sure. But logically speaking, May 24 seems a very viable option to conduct it rather than November 23. But the NMC is going at a very fast pace. Last month they decided AIMS is going to conduct the exam. Next month they're going to give a mock exam. So if it happens in November 23 also, we cannot be surprised that it will not happen. But logically speaking, now your May 24 seems a viable option. And then once you pass that, you enter internship, and next 2 will be there again in the month of June or December. And they also told that there'll be 2 counselings, right? So these are the basic information with us. So we'll be taking one by one queries of yours, and we'll see how to take care of it. And I'd like to invite Dr. Sandeep to comment on what is your opinion on next and how to go ahead about it. Over to you, Sandeep.
Hi, sir. Hi, guys. A big announcement today, as sir has described everything that we have in our hand. This is the first concrete information that we have, probably a more reliable source. Everything which has been told previously is what is being formulated now. Yes, there are a lot of gray areas. Yes, there are a lot of concerns. Yes, there are certain issues that have to be addressed. But one thing said, yes, 2019, guys, you are up for next. And yes, as sir told, probability of happening next is more likely to be in the next year May rather than this year November. But again, don't be shocked if it happens November. So let's be focused that it will happen in November, and we'll take accordingly.
Yes. Question on whether 2020 batch will give ENT in Ophthalm. If today's NMC chairman, he said that the people who have already given exam in 3rd year, ENT in Ophthalm, his words, you will be comfortable in giving it because you already passed it. If it's coming in next exam also, you will be giving the MCQ in the next exam as well. So people who are going to give the ENT Ophthalm in final year or in 3rd year, even if you're done in 3rd year, you will have to appear for the papers in final year also to clear to get the MBBS degree. Whether you have done the exam or not done with the exam, that doesn't matter. So hopefully if your university is aligned to conduct an exam, you will be giving the exam as well. Fine. Samir and Zaira has a question on how about FMGs. What's your take on that, Sandeep?
Sir, FMG, this July we have exam. Now, if next appears in November, it is very unlikely that there will be a session in December. Or if it occurs, or if let's say even they decide to have in May, they will have one session in December, and then May onwards it will be next. So it all depends upon what I see from the today's discussion and on all the various social medias and various sources that I've heard. For FMGs, it's going to be slightly tricky, but what I'm saying is, or what I predict, this June is probably the last FMG, if not second last. After that, it won't. So yes, for FMGs, those who have cleared, well and good. Otherwise, you have to take next here after July.
Okay. MBBS MP and Ronak has asked for INICET. See, again, INICET, the slots has been open for the November exam. So if again, INICET and FMG exam is totally dependent on when the government is going to push next exam. But since they have a little bit clearly given a hint on NEET PG might happen for this batch, so INICET also should happen in this batch. if they want to merge INICET with the NEET exam, or if they want to let go of INICET and keep NExT as a complete thing in November, I think we'll have a clarity in few days, because the Gazette has not been announced. So once the Gazette is announced, we'll definitely have more clarity on what is about the FMG and the INICET exam. As of now, it's a big question mark for everyone. We can make guesses. A logical guess, INICET should be there, since probably May will be the appropriate time for the exam. But again, it's a logical guess. Might be right, might not be wrong. There's holds true for both INICET and FMG as well.
Okay. So Mo has a question. It's like, what is our strategy, how to approach first and second year subjects, as they will be mainstream in the main exam? So
Okay.
first Prof, second Prof.
Yeah, see, what's going to happen over the period of years is, like, if you have observed USMLE exams, they are kind of trying to replicate that. So MLE has kind of step 1, step 2, and step 3. In India, we have NExT 1 and NExT 2. Same with clinical experience in the NExT 2, and your MCQ part in the NExT 1. So first and second year exam is going to be a base. So though it is a clinical based exam and all the MCQs are going to be case scenarios, to understand the case scenarios, you need a little bit of basics. So what we would say is, we'll help you with the foundation. We have live classes with the DPPs. So once you learn a topic, you solve the MCQs, slowly build up acumen to solve cases. Once you have the acumen to solve cases, you add on to your final year subjects, so that it's very well streamlined. So there is going to be a little bit of like 10-20% of FMG, your first and second Prof, and also your community medicine and FMT. The major chunk is going to be clinical subjects, but the correlation will be made much better if you understand the basics. That would be my take. So for everything in the be it PSM, be it in your forensic medicine, be it your path, pharma, micro, anat, physio, biochem, learn the clinical aspects of it. And we are all waiting for the July 28th mock by AIIMS. That I hope will give us more clarity on how they are going to build up the things. If it's going to be in completely something which I cannot solve without understanding some basic subjects, we'll have to incline towards it. What I predict is, over the period of time, we might not be remembering every nerve root, every root value, but yes, I'll be remembering if this nerve gets cut, it's going to become like this. The symptoms or the scenario will have more importance, right?
Sir, I would like to add one point to yours. Just I'll take a quick second. See, first year, second year subjects will always remain relevant. I'll give you from a surgery point of view. We have seen MLE exams. We have seen the PLAB and MRCS. Probably Indian system is moving towards the same scenario. Now, there will be a comprehensive question, which we're going to be pretty long. It will have 5 subparts as a question part. Now, let's say if I'm talking about thyroid cancer, there will be about diagnosis, there'll be about management, there'll be about histopath also. They'll give you a slide of some more bodies and they'll ask you to identify. So without having your patho knowledge, I don't think you'll be able to solve those questions. So yes, first and second year subjects will still remain very, very relevant. For example, we talk about the variation of superior thyroid artery, that will be an anatomical question. So yes, it will be very, very well relevant, but yes, the implication or the way it has been asked might change.
Amarnath, as a question, will MedEd have a mock exam as per the next pattern? Every final year student is requested by the NMC chairman to register from tomorrow for the mock, which is going to happen on July 28th. So let's have a clear-cut pattern on what's going to happen from July 28th from AIIMS. Definitely, MedEd will have multiple tests, not just mocks, so that you will get groomed and you will definitely. Our goal is to make things much easier for you. First of all, don't panic. That's very, very important, because this is new for every student across the country, not just student, the teachers also. So everyone is in the same boat. No one has an undue advantage. So it's about what is going to happen from July 28th till the end of the exam date, how you're going to prepare, how you're going to pivot, how you're going to make the best use of your time. That's going to decide your mark. So everyone is starting the race from the same line. So it's how faster you're going to get to the finish line is totally left up to you, and we'll definitely help you to support in every way possible via MedEd.
So pattern of exam is asked by Sajid. I think you have a slide for that.
Sajid, the pattern of exam as per the NMC, again, this was what was in the draft as well. This is what was displayed in today's thing also, your meeting from the NMC. It's going to be this distribution. You will have a problem solving analytical type of question of 60 to 70%. You'll have comprehensive type of question of 10 to 30%, which was what Sandeep was saying, that I'll have a big stem like 5 or 6 lines or 8 or 10 lines, and there'll be 2 or 3 or 4 questions based on that clinical scenario. Maybe we are going back to a school days where we used to attend comprehensive type questions. Same with a clinical scenario here, and recall type of 10 to 15, 5 to 10, 15%. This recall type MCQ or not, we're not like one liner or not, we're not sure. Maybe our mock will give us more clarity. And this about the topics. Every university has a must know, nice to know, and may know topics, and must know is where 60% is concentrated on. So it should be easy. And the exam pattern is going to be like this. You have medicine allied, surgery allied, OBG, pediatrics, ENT, and ophthalm, right? And 120 marks. Items are the number of questions. See, again, this items is also something which is being replicated from an MLE. Because MLE, they call them as sessions and items. So items here means MCQs, or one MCQ or one scenario based on that one or two questions more. See, the reason why multiple choice is not used in an MLE pattern is sometimes there'll be extended matching. Sometimes there'll be comprehensive types. That's why they use the term items. The same thing has been done here as well. So same for evening, this afternoon session will be 60 questions of pediatrics, ENT, and ophthalmology, right? Okay. So this is in short about the maybe the pattern and the way the exam is going to happen, fine? So there are more questions here. Hard copy notes PI will definitely release very, very soon. I am not committing a date. I'm sure that very soon is not the right answer you're expecting for. And once it's out, I'll be the first person to tell you, yes, it's out, and we'll be very happy to hope it reaches you soon. Fine.
So Prajwal has a question about foreign students who want to do PG in India.
Go ahead.
Yeah. So guys, it's gonna be same. For every foreign medical graduate who comes, who used to give FMGE to get into the system and then do your NEET PG and then go move forward. If you look at from a neutral point of view, it's such a good opportunity. You don't need to give 2 exams, right? We will finish with NExT, get along with internship, finish your internship, and then something has to be clarified from the NMC is the internship in few countries, as I've been interacting with students, that in few countries the internship is validated, in few it is not. So they don't have a uniform system. And as far as my knowledge goes, you have to do internship after you finish your next one. That's what the basic objective is. So to get into the PG in India, you have to give both next one and next two. That is inevitable. That's gonna happen, right? So I hope that answers your question. Sir, how to approach PSM? Please tell, Zaira.
Zaira, you have asked 2 questions. I will combine both. You're an FMG student. You are very anxious. Like I said, the exam here is something new for every student, be it FMG, Indian medical graduate, first year, final year, intern, post-intern. So when it's going to be implemented, if you're going to be strong in your subjects, the diseases are never going to change. The route of diagnosis is never going to change. The management hardly changes. So the 65-70% of any exam is going to be based on the same diseases which have been dealt for years together. So be strong in that. Whatever they change the exam, whatever they change the pattern, medicine remains the same. We'll learn medicine and we'll definitely say it through any exam here. Ali asked the question of what is PMR as a subject. See, PMR is physical medical rehabilitation. So when you have a fracture, you get bedridden for some time and you have to regain your power. When you have a stroke, you have physiotherapy. Physiotherapy is your PMR. So it'll be a little bit of component of orthopedics. So whenever orthopedics is there, whenever the rehabilitation should be done, PMR, that's what PMR means. And you will have, when you have postings of orthopedics in your internship, you'll also have a little bit of physiotherapy, and the PMR medicine also be taught to you a little bit. Fine.
So will there be sorry.
Malik has a question, will there be a negative marking in NExT? Your take.
Sir, if it is comprehensive and it has to be competitive, they will have to come up with negative, or
as per the previous draft and here also, the negative marking is not there because it's a qualifying exam. See, because FMG is a qualifying exam, NExT is a qualifying exam. So the negative marking is not there in the draft. Again, for everything to be completely acceptable, the Gazette should be there. So once the Gazette comes, we'll be much more have a clarity on it. But generally, a qualifying exam, if there's a negative marking, it'll be a bit difficult. That's my take on it. If negative marking is there, since the only concern, like what Sandeep said, competitive and qualification. So they are trying to club both, because every competitive exam has negative marking. Almost every qualifying exam doesn't have a negative marking. So what does their stand and how they're going to combine it, we'll have to wait for them.
More logically, it sounds there shouldn't be a negative marking, because it's more about qualification rather than, the competition here on. Okay. Are there multiple choice questions? Of course, yes. The whole exam is going to be, next one is going to be objective. Sir, must know topics, where to get them? I mean,
See, most of the university websites and their syllabus has few things labeled as must know. In the CBME curriculum also, if you see, there'll be few things we have to know about it and should know and good to know, right? So we'll gather the topics for you. We'll make sure we create a proper flow in while we teach in PW MedEd. Okay, these are must know topics. And when the notification comes live and it's official on the NMC website and on the Gazette, and when the mock comes, we'll make sure we'll have tiny live sessions of every subject in a balanced way to prepare for your upcoming next exam. That's a promise from all of us here. We'll definitely not going to let you leave. And it's a challenge not only for you, it's a challenge for every medical student and every doctor in the country. NMC is putting some big, trying to put something big, and we'll definitely hit every ball to 6, right? You don't worry about it. We'll definitely do it.
So will university exam of third prof also be replaced by NExT? Would it be replaced by NExT?
See, if you look at it, the first and second year students already have ENT Ophthal in final year only. So the two batches where ENT and Ophthal is there in third year is of a concern. That take will be left totally to the university, because next, the NMC chairman clearly told in today's meeting that even if you have cleared ENT and Ophthal in your third year, you will have to write the exam in the next one to get through MBBS. So that's there. So will the exam be there or not sure about it, right? Okay, Cafeteria has a question. I want to do a PG in a foreign country like UK. Is it mandated to give NExT PG or NExT 2? Your take, Sandeep.
Sir, you need a primary qualification to apply anywhere in the world. Without having an MBBS degree, you cannot apply any exam anywhere in the world. So yes, you need to give NExT 1, NExT 2, get your qualification as a primary MBBS doctor, and then decide whether you want to go with PLAB or MLE. So it's mandatory.
I think that's the catch what the government wants to do. You have to clear this at any point, be it any country, be it a fellowship program, whatever you're going to do abroad. Without a degree, we are going to not be considered as doctors, right? So you have to give NExT 1 as well as NExT 2 after internship to get an exit. There's an exit exam, right? It's more of a qualifying competitive exam. It's a qualifying exam. So you get NExT MBBS degree, then obviously you can go to whatever country you are. But yes, you need to clear this to go ahead.
Bharat Shiva is asking what are allied subjects?
Okay, allied subjects. See, when we say medicine and allied subjects, dermatology, right? Your psychiatry, anesthesia, surgery, allied subjects, your orthopedics, all these surgical subjects which are not a mainstream subject, or in NEET PG exam, we used to call them short subjects. Those are called as allied subjects like radiology, orthopedics, skin, anesthesia, psychiatry, all of them are allied subjects. So when you take surgery, surgery is going to still form a chunk of it, but allied subjects will have a little bit of input, same like whatever like NEET PG has, this same thing. It's instead of calling them orthopedics or psychiatry or radiology, they have put them as allied subjects. That's what allied subjects mean. So Pranavi has a question. Will it be November 23 or 24? Clarify.
Sir, okay. By the notification, it should be November. But again, if you ask me personally, the way NMC is doing things and the way the intent has been shown, I think they will push it for November. In fact, if I was a student, I would prepare for November because worse might come. And if not, you have time until May.
So see, till next month, till when the mock exam comes, don't stop reading. Stop doing the same thing. Make your reading more conceptual than memorizing things. Because here the one-liner is going to be very, very rare or almost nil, like whatever they have said. It's going to be more of solving an analytical basic skill, problem solving skill rather than memorizing thing. So make your reading conceptual, develop the problem solving skill. And once July 28th comes and we know the pattern, if it's November or May, we'll make sure we'll guide you at each and every step, every day possible, and you will clear the exam.
So there are a couple of questions I'll just summarize for you. And I think it's important also for you to address. If a student is in first year, how is his approach? Second year, what should be the approach? Third year, what is the approach? And thereafter. So let's go on a sequential manner. Let's say a student is in first year now. So how should he approach?
Okay, I'll put the thing in my shoes, right? Let's assume that I am going to enter first year of MBBS with the existing knowledge of how the medical system and everything works. Because the problem with the first year MBBS is they don't know what exactly it is. They are extremely confused about it because they don't know how a hospital works, how a surgery or how a medical management works. So since I'm working for some time, and Sandeep has also been a practicing surgeon, so we know how exactly the system works outside your student life, right? So when Sandeep is going to do a surgery, he should definitely know the anatomy, the variations in the anatomy, so that no major injury happens. So like I said, instead of memorizing things, if I know the clinical anatomy stuffs, like if you have gone through Chaurashia or Gray's anatomy, every topic will have a clinical anatomy or an implication. That is important, but the rote learning might not be important. PSM, programs might be important. When was RNTCP launched might not be important. In pathology, genes which have management might be important, like BRCA might be important. Thyroid cancer also has genes, but not used in management, might not be important. Pharmacology, side effects of unique, like all the side effects of pharmacology might not be important. But when you take iron, gastritis is one of the important things which you have to tell to a patient, that might be important. So if you're in the first year or in second year, always put patients first. If I'm going to become a surgeon in future or a physician in future, will this point what I read will be useful? If that is useful, read them, remember them, recollect them. If you think it's not useful, we are there to guide you whether it's going to be useful or not. We'll pivot our learning towards patient management. So once that is sorted, I think your base is done. So once you come to your third year, you have to practice a little bit more questions, because see, this question, the exam is 540 question base. So when I have a 200 question based exam, I practice a little bit. It's going to be almost more than double, close to triple the amount. So more the questions you practice, more you get used to solving skills. And third year and fourth year onwards, because only when you come to third year, you have the acumen of solving everything completely. Because in second year, you'll start going to postings. You learn how things work. And third year will be definitely much more mature. So your solving skills becomes better. Third year and final year, solve questions and give the exam, come out in flying colors, enjoy internship. Don't worry about next two. Next two is going to be a little bit easy practical exam, like they said, cases, OSCE pattern. Because in your final year practical, you must have already done cases. And internship, you have worked. So I think next two should be a little bit of less impact for students. And it's going to be pass or fail, competent or non-competent. It's not going to be ranked, right? I think that's how what I feel. If I'm a student, I would put myself in your shoes and I'll do this. There are few things on.
One, by Supreme Court, will it get cancelled?
Yeah, no one can predict it. Only the my lords can predict it, and hopefully it's in the hands of the judiciary system. They are not going to cancel it. See, cancelling will not happen because they guess it. So it's not some random test announced by NMC. It's a gazette. A gazette is a law. Supreme Court doesn't have anything to cancel about a law. So will that be any postponement, tiny things? That I am not the right person to answer. Let it come outside and let's see how the course takes. But definitely NExT is here to stay. It's not going to go away anywhere. And the number of attempts in next one. See, if you look at the draft, what it happened, they said that if you don't clear one subject, let's say that medicine, surgery, OG is there. I cleared every major subject. I didn't do well in ophthalmology. I didn't get the 50% in ophthalmology. So next, the draft said that you can give ophthalmology alone separately and get it cleared, like a supplementary exam, what you have in university exam. But today's meeting, the supplementary concept was removed. So either you clear all of them or you give the exam again in 6 months. When you give the exam in the next 6 months, it should be all of them, not one paper alone. Okay. So that is how it's going to be. So you will have re-attempts, because if they said you're going to write it again, number of attempts you're not sure, but yes, re-attempts will be there. And will average marks be there or not? NMC has not cleared it. Everyone is waiting for that average marks to come. If it's there or not, we'll see how to take care of that. Right?
So Sairam has a question. INICET in November, because he got 358 rank preparing previously. So how would you look at him?
That's a very, very good rank. And I hope if you got in the November 358, your NEET rank should also be good. So first is your aspiration, because NEET counseling has not yet happened. So if your NEET rank is also good, if with this chaos and by the time NEET counseling happens, I think we'll have more clarity on November 23 exam will be next or not, for sure, right? So if I were in your shoes, if I got a good rank in NEET, I would take a PG and escape. That was what I will do, because with this lots of uncertainty, the ball can turn here or there, right? If INICET is there, if you want to give an attempt for an INICET again, and if INICET is there, I think you can give your INICET exams after joining your PG also. If you've done well in last May exam of INICET, I'm sure you must have kept reading. Little bit of push, definitely do that as well. Fine. Medical negative marking, like I said, a qualifying exam generally should not have a negative marking, but we'll wait for it. Generally, there should be no negative marking only. Negative marking, which is there, the exam is going to be a bit more difficult. Right?
Okay. Fine.
Diksha has a question. The timetable says the internship is from Jan 1st. Can you explain your take, Sandeep?
Sir, what they mean is if, let's say you're finished your next one in the month of November, then starting it from January makes sense because the results will be declared, then you'll be given some time, your postings will be allotted, and then you can move on. But if it happens in May, I don't think the internship will be due in January. So there has to be some sort of clarity on that, which I also got a lot of personal messages like with regarding to internship. So again, I'm not very clear on it, but if it happens in November, yes, with the internship will start in January. If it happens in May, that is next year onwards, then I don't know, probably they'll start from June, July in that sequence.
See, I have just displayed the timetable for you guys. This is what was there in the meeting today. So next one, like Sandeep said, if it's in November, December, the results comes and your university practical exam happens. See, next one is in theory part, that's all. So university still you have to present a case, you'll have an examiner, you'll have to clear that. That will be done by December. By the time it's December is done, results of next one also will be announced. So those who has passed every subject will be eligible for internship in January. But if you're taking the other route, let's assume for a student didn't do well in November exam, didn't clear 1 or 2 subjects. That student has to reappear for May. That student who reappears for May, they'll have to give in June the practical exam, and in July, they'll start the internship. So it's going to be 2 things. Those who are cleared in the first attempt goes in the routine one of November, December, and January. Who's not clear is going in the route of May, June, and July. So that's what it is. And they have also told that the counseling also will be twice. Because if it's a PG admission here, the counseling also is going to happen twice. We should have a more of a clarity regarding that as well. So postgraduate course, again, there's going to be 2 sessions, one in July and one in January. There's something said that the counseling which happens for the lesser number of students will be the seats which are not filled in the main counseling. And maybe probably the INICET will also come inside because INICET happens twice a year any which way, right? So that's what the take of the timetable is. And there are a few more questions. Please, Sandeep,
Sir, Arpit is asking FMG December 2024 होगा या नहीं? December 2024 वो तो 100% होगा. You're asking probably this December 2023 December. If you take what is happening, November, if NExT is happening, you will not have an FMG in December. You will directly come in May. That is what the draft basically explains, because they will not, use the resources or redistribute the students again and again. तो अर्पित में we say अभी जो जुलाई में हो रहा है वो आपका last FMG है, most probably. उसके बाद अगर नवंबर में अगर आपका NExT होगा तो it is unlikely to have an FMG exam separately from there onwards. ठीक है, तो ये again all these are the predictions that we are having with whatever amount of experience or knowledge that we have. Again, if NMC comes with some different bomb तो नहीं explain कर सकते, but अभी के लिए मान के चलिए कि 70 to 80% दिसंबर में FMG नहीं होगा. Right, sir.
There's one more question from Divyanshu. Like, I'm a batch of MBBS 2020. Will I be appearing for November 24 or May 25? See, one thing which is not clear is what NMC has told us. If you have cleared MBBS final Prof part 1, the third part 1, which is 3rd year, you are eligible for NExT. Whether if I'm eligible after 3 months or 5 months or 12 months, it's not there, because that's how foreign exams are. If you clear one, you can write at any point of time based on your acumen. So again, it's resembling exactly what the foreign curriculum does. But having said that, I think this dual pattern over the period of time should merge to one place. So once I finish my 3rd year, you should minimum have a 10 or 12 or 14 or 18 months as per the new curriculum, complete that, then you'll sit for the exam. Because this exam is going to be based on your acumen. So I don't see any point a student attending this exam in 6 months into final year. So it should be completing the entire course, and then only the student should sit for the final year, the next one exam, right?
So just do anything as asked. If next one happens in November 23, then our final year is going to be just 10 months. So will that be justified from NMC's point of view?
See, that's where someone asked, will Supreme Court cancel? That's where courts should intervene, because for you, it's 10 months. There are few colleges in the country where it is started by May. There are few colleges in the country where the final year started by June. They are less than that. So how they're going to place it is totally dependent on NMCs and the court decision to intervene if someone is going to challenge that, right? That's not in our hand. Let's not overthink for now. Let NMC clear the gazette and say it's going to happen on 23rd of November. Then yes, we'll have to take the steps accordingly to see whether it's right or wrong. Definitely, judicial system should intervene in that. So Rahul, the book and DPP will be on July 1st. We'll come live in a couple of days and tell you. The book should be available very soon. We'll update that as well. Sati has a question on 10-year completion of MBBS course attempts of NExT. See, Sati, the law of you have to complete the MBBS within 10 years of joining the course is present now also. It's not been highlighted, that's all, because most of the students, almost 100% of the students will pass the exam within 10 years. So now they are highlighting it. That's the only thing. That's not a new law. It's an existing law. Even now, or when I studied MBBS also, if you don't clear MBBS within 10 years of joining, you cannot clear it. That's how it is. Now it's been just been pushed outside in the public. That's all.
Neha, will next exam will be replaced by NEET PG? I mean, next will replace NEET PG or not? It's a simple.
It will. Yeah. It will for sure, but when, we are not sure. MP is a question of what should we keep the date for NEET PG, November or January, so that we can plan our schedule. Your take on that, Sandeep?
Sir, okay. First of all, I'm not very clear whether how things are going to move forward. But if, let's say, November NExT happens, so the NEET won't be happening in November. That's for sure. So it has to go for the further date. So if I am preparing, and if, see, sir, if next one is going to happen in November, I think that should solve all the questions, all the speculations that are happening. If not, yes, then you will have a NEET exam, and then in May you'll have NExT. So that's how it is gonna go forward. Again, the draft also says that it has been drafted for November only. So if the November is happening, I don't see, the NEET happening anywhere around it. So it will be pushed further. So any take on your side, sir?
See, one logical thing here is like this year NEET counseling has not yet started. We gave the exam way back. Results also has come, but still we are waiting. All the aspirants are waiting for counseling, right? So it's going to take lots of time. So the counseling might supposedly happen the July 3rd or 4th week, and the colleges might start by August. So most probably, if they're going to keep a batch of NEET by December, it's very unlikely, because the new students have joined only in August, and I cannot have one more exam within a span of 6 months. So exam will be pushed maybe in the same alignments of Feb to April somewhere, or even a little bit further. Or if they are going to merge it with May 24 NExT, also, we have to be fingers crossed. The gazette should come. That will clear all the confusion. Unfortunately, though the NMC chairman addressed the students, they didn't address two key points. One is, will 23 exam happen? And second, what to do for students who are post-interns and interns currently. So there is a subtle mention on NEET PG might exist, but they should have made it much more clear. If they made a beautiful PPT like this, they could have just added 2 points. I think that's been done purposefully so that it won't cause more chaos among students and more repulsion from student sides towards the act, right? Saikya, you have a question of the first prof. For the students who are joining new, there'll be new first prof. Don't worry.
Yeah. So Amin Chaudhary, sir, FMG students को next clear करने के बाद इंडिया में 1 year internship करना पड़ेगा क्या? The answer is yes. It is आपको करना पड़ेगा. Once you do, you will go through the proper system. Next one internship, next 2, and then PG. That's how it's gonna be.
Be it India, be it FMG, it's going to be the same.
It's gonna be uniform, right, sir? Okay.
Sagnik, if someone cannot clear next 2, will they have to reappear for next one following year? As per the draft, no. You have to but reappear for next 2. So if you cannot clear next 2, which means you're not competent in the clinical skills, you're competent in the theory skills. If you're clear next 1, that's what it means. So you have to appear for the next 2. But again, next 2 also has twice a year. So if you don't do it well in June, you'll have to apply in the next December. That's all, right? So if you're clear next one, that's done, and you have a score that's there forever. If you're not done next two, if you're not qualified in next two, you have to give next two again to get an MBBS degree.
Sir, a lot of questions. Will INICET continue to exist or will it merge with NExT?
INICET will not continue to exist. November, we are not sure, but going forward, it will be one exam throughout the country, be it AIMS, JIBMA, PGI Chandigarh, or NIMHANS Bangalore, or a government medical college, or a private medical college. It's going to be single. INICET will cease to exist for sure in future, but November might not. For that, we have to have some more clarity on that.
So Diksha has a valid question. So now that I've passed next one, if I have to improve my marks, when can I get the next attempt?
See, there are few things purposefully the NMC didn't address in today's meeting, which was there in draft. Draft had a concept of average marking. So draft said that the draft and not the final one, the draft said that if you are going to attempt the next exam, let's say 3 or 4 times, the mark will be average of all the 3 times. So that's a very, very, I would say at least a tough thing, because it's not the best attempt, it's an average attempt. So for that, we have to wait for the GAZette. Is it going to be still maintained or not? Anyway, you can give a next attempt. So because you have twice a year exam. So if you do well and you don't do well in November, December, but you have passed, but you still want to improve, you can give the May exam. But I feel that the average will still exist for the only reason you're giving 2 exams. So when you give 2 exams and there's going to be counseling happening, ideally the average should exist. If they don't exist the average, it will be the best. So I feel NMC should release that in the Gazette. They maybe conveniently skipped that part in the today's meeting. They didn't talk anything about the average. Gangadhar has a query: is it required to read deleted chapters?
So what are deleted chapters?
That's the first question for my as well. What are deleted chapters?
No.
You are talking about the good to know chapters, the 10% of whatever NMC said. If that's there, see, they have a categorization of must know, very well to know, and good to know. Yes, I would say concentrate more on the 63% and 30%, finish that, and then go for the 10%.
Yeah, if that's what he means. Sir, India के students के लिए भी होगा क्या next exam 2024 में? Same. Next is for everybody, beta. It is not IMGs के लिए separate or India के लिए separate. When next happens, all of you are going to be uniform. The objective of this exam is to get a uniformity, not a multiple exams throughout the year. So basic objective of NMC is चाहे वो NEET हो, INICET हो, FMG हो, सबको merge करके एक exam में, ताकि everybody remains uniform, and obviously the government also want to have less hassle, and the portal of admission will also become uniform. That's the objective. So सबके लिए uniform ही रहेगा. ठीक है? Okay.
Iram has a very valid question. Will there be November INICET, or based on next 1 marks, will they fill INICET because AIMS is conducting it?
Sir, I think they will have INICET, sir, because it's a 6-monthly thing and they've already released the this thing also. So I think November INICET should happen, but as he has a valid point, because AIMS is conducting, will it consider that and give the admission? So
a very valid point, Sai. Like, unfortunately, both of us are not in a position, or neither on one in the country is in a position to answer your question. The Gazette comes, we'll know it. Both for FMG will happen or not, December, or my NEC will happen or not. The Gazette will definitely give us much more valid thing, right?
Sir, will ophthalmology be shifted to final year subjects, sir?
It's already in final year, right? Opthal ENT is already in final year from the current second year batch, if I'm right. Correct. So 2021, yeah, 2021. I think it's already in the final year, so you will be giving it in the final year only.
Okay.
Avik has a question: can post interns appear both for NEET PG and NExT in 2024? Why?
No, that's what I'm like. Okay, nothing funny about it, but then why do you want to do same exam twice?
See, if the government says that go for NEET PG, get a seat, please go for NEET PG, get a seat and escape. That will be because you have an advantage over others, that you are not pushed to take NExT. But if you just want to take NExT, maybe if you feel that you're not prepared well for this year, and maybe you think that you will have to give the next exam for next year. If you feel that, because that's the only notion, I think, why should you sit for next exam? So if you feel that is the reason, yes, please go ahead. And again, once the prospectus comes, there'll be an eligibility criteria. If the eligibility criteria says only a final year MBBS student can give, you will not be an eligible person.
Preetha Chakraborty, sir, AIMS Delhi is conducting mock. Will it conduct next one also?
Yes, the exam conducting authority for this year is going to be AIMS. That's been announced by NMC already. So it will be by AIMS only. The exam will be by AIMS only. Fine. Mehul has a question of, will next one be 2 times a year or 1 time? Next one is twice a year, right? It's going to be in your...
Sir, one clarity here. When we say twice a year, so those who have failed the first attempt, they get to take the second attempt. So that is the next one second part. That's the supplementary part, right? So primary next one is only once a year.
Yeah.
Right.
So whether the reattempt is possible for score improvement, that clarity and the average mark clarity is not yet there.
Yeah.
Samim Kazi, how the second year student should approach next exam? I already told, form a base in the first and second year. Please attend your clinics in the first morning session of the second year, because that's where you get to apply whatever you've read. Generally, what students do is relax and start clinical postings in the third and final year. Please start it early. That's what early clinical exposure is, what the NMC is also stressing on. That helps you to develop the problem solving and analytical skills. Because how much ever you read a book, you will never become the best person unless you practice it. Practice makes any person perfect. Rather than practice in MCQ, practice in a real patient, ask a history, formulate the thought process, formulate the algorithm, and then slowly when you come to third year, apply them in MCQs and excel the exam.
So one question which has repeatedly been asked, like, how does an FMG approach? What about the FMG? How would you do about FMG? I'll just quickly take 30 seconds just to, give them a perspective. Guys, all those who are doing FMGs, one thing earlier used to come down, take one exam, that is FMG, clear it up. Again, I know how hard you prepare for that. Then you apply for NEET. And again, depends upon what attempt you're taking. You might have to wait for 6 months or a year to give the NEET PG exam and then secure a rank and then start your PG. In between, you have internship. So a lot of time that is being consumed down there. So it's actually a very good opportunity from where you're standing right now. It's only one single exam. You know where to focus on. Come, do your next one, finish your internship, get into the system, finish your next two, go to your residency and settle off, right? So that's where you're looking at. Don't see, earlier also you were giving FMG, which was an equally tough exam. Next one won't be anything more difficult than that. It's the same thing. Yes, from now on, your orientation of preparation will change. Like as sir was telling, you need to start developing your clinical acumen. Now, a lot of colleges down there might not have much of clinical exposure. So what can you do? Now, here, people... you can have a bit of assistance from, from our side as well, where we'll also be coming with, clinical scenarios, clinical discussions. We do a lot of integrated sessions where you can use those to get yourself accumulated. There is nothing that you're going to miss out. The only thing that you have to concentrate is how you're reading and continue to read that. There is, just imagine next one is renamed or a rename for FMG. That's it. So there's nothing more worrisome for that, right?
Sangmesh, yes, it's 2022 onwards. This batch is 23 and the previous batch. From the previous batch onwards, who is in second year now, yes, they are going to have in the final year. But till that, your university exam might happen, might not happen. Even if it happens, you will have to give ENT and Optal in the next one.
So Rishabh is asking, will third year university exams will continue to happen or will they be taken over by the next exam?
Third year university exams will happen for sure. Whether it's going to be ENT, Optal, community medicine and forensic, or only community medicine and forensics, should be confirmed soon.
Okay.
Yes, you will get your MBBS degree certificate after next one and next two. You should complete both to be labeled as a practicing doctor in our country. Melon and Fireflies has a question on 19. It's now for 2019 batch is November 23 or May 24. Like I said, the NMC has done so much of work in the past month. So if they want to push it for November 23, not be surprised, because they have done extremely fast-tracked everything. November 23 might seem logically impossible for us sitting from outside, but if they have done, just last month, they said that AIMS will be conducting a 30, maybe 2 weeks back. Now, after a month, they're going to release a mock. They conducted a webinar. They will put it in the Gazette. So if they've done so many things, they might be ready for the November, because if they're going to push it for November, we have nothing to say. We have to sit for the exam in the November, right? But there are a few things which might not make them do it in November. But again, those things, like I said, there are a few things are not clarified, still in gray zone. We'll have to wait for NMC to clarify it. Tabasam average, not sure. We'll have to wait for NMC to clarify on that as well, right? Okay, I think we most of the answers what you're doing is more or less more of repeated questions. We will call off the session. We will definitely come live frequently to guide you. This next 1 year, till the first exam happens, it might be a difficult phase for you. Don't worry, we are here to help you for that. Once the first exam happens, you'll not worry about it all. It's one more NEET exam, that's all. It's just named exam. Anything to start, there'll be a struggle. And everyone here at PW MedEd is going to help you, be it the academic or the non-academic team. We have very hardly working on changing every source for you, the question for you, the way of teaching for you, aligned to the pattern. We are just waiting for the final confirmation for the next. And we do have the capacity to run multiple live batches. So once the next is announced, and if you feel that we want more solving of MCQs and we want teachers to come live, we'll definitely make that happen. Slow and steady is definitely going to win the race, and we'll be all the way with you guys. Fine. So thank you for your time. And Diksha, don't worry. When you read your final year subjects, please go to the pathogens a little bit or anatomy a little bit, understand the clinical part, you'll be able to ace the exam, fine? So if you have any other doubts, please ping any of the teachers at PW MedEd. We have a Telegram group. The Telegram group link will be pinned in the comment. You can ping any one of us. We can ping in any of the social media channel, and we'll be more than happy to help you guys, fine? Thank you. Thank you for your time. Thank you, everyone. See you soon. And don't worry. It's again, don't panic. Just take a deep breath, eat an amazing dinner, go and sleep. Everything is going to sink for sure. Both good times as well as bad times do not persist. Whatever it is, it's going to come back to the normal. That's my take. Thanks a lot, everyone.
Thank you, guys. Thank you as well. As Sir said, everything is going to be same. And one small thing, every exam which is going to be the first exam is the most easiest of all. So this next one will also be easy, right? So chill, relax, have a good meal. And yeah, as Sir said, we'll always be there. Thank you, guys. Thank you.
Bye-bye.